So there's lots of work to be done with this patient. Now, unfortunately, he's got advanced kidney disease. We don't know if we can turn that around, but we certainly can address these underlying problems and possibly the synergistic effect to get the blood pressure in control, and maybe there could be some recovery possibility of his kidneys. But this, presentation underscores the importance, of understanding that the body is complex and we have to address these problems, from a systemic process. Okay, guys, so we're here today in Montgomery Heart and Wellness Clinic. And so who has the first patient? We saw a lot of people today. Who do you want to talk about?
Yes, the first patient is Mr. NR. He's one of our outstate patients. He's a gentleman, 43 years old. His medical history includes high blood pressure, which is diagnosed around 4 years ago. And then he mentioned a year and a half later of that diagnosis, he had been told that his kidney function is deteriorating. And over the past 2 years, he had been diagnosed with stage 5 kidney disease. The recommendation from his doctors that he should consider the dialysis and also to look for a donor for kidney transplant.
Interesting.
Yes. So
anything on the physical exam that was telling no abnormalities and murmurs, nothing like that, right?
Yeah.
I remember, having a conversation with him, after you spoke to him. And, his history is interesting, largely because this is a young man who's 43, and about 3.5 to 4 years ago, he felt bad and they've had a headache. His mother checked his blood pressure and it was elevated. So they took him to the emergency room. He was started on, medication, clonidine, and said to his primary care physician, who just adjusted the dose. So for a period of about 1.5 years or 2, basically his doctors, they did the basic blood work, echocardiogram, EKG, and all of that was, within normal range, quote unquote, by his report. We haven't seen it. But the interesting thing is that he was just given various medications. His kidney function was normal initially, and then, as you pointed out, 1.5 years ago or 2, it was found to be stage 3. At that time, he was taking losartan, hydrochlorothiazide, and then I guess he saw a kidney specialist, and now it's progressed to stage 5. What really struck me about that history is that he saw a number of doctors and specialists, and it was just a matter of adjusting medications. I asked him, well, did he put you on a special diet today? Express to you what their thoughts were in terms of your cause of high blood pressure. So the kidney failure could be due to high blood pressure, but it could be due to something else. But there was no discussion of that. And so I want to stress one point. In this situation, there was just an approach to adjust medication. So there was a so-called treatment, if you will. But even though there was a diagnosis of high blood pressure by itself isn't necessarily a diagnosis. It's a manifestation of an underlying problem. The underlying problem is a diagnosis. Now, we may not always pinpoint exactly what that underlying problem is. When we look at high blood pressure, we have what's called essential hypertension. We have secular hypertension. Secular hypertension are a list of somewhat rare or somewhat unusual abnormalities where you can say, okay, this is an abnormality that can cause the blood pressure high, so the blood pressure is secondary to this. However, essential hypertension, we call it essential hypertension because it's usually due to multiple things. And so we don't have one thing we put our finger on necessarily. However, despite that, we should still look and try to gather information on the multiple things that are having an input to high blood pressure and address those things. And the unfortunate thing, he was just given medications just to treat the
high
blood pressure, but not address the underlying problem. For example, dehydration can cause high blood pressure. Magnesium deficiency other metabolic abnormalities can cause high blood pressure. And these things can be addressed and corrected. In fact, dehydration or volume depletion, as some people call it, is very common. And by simply hydrating someone, starting them on magnesium, putting them on a healthy diet, the blood pressure can be controlled with fewer medications or without medications. Not only that, these approaches helps the kidneys and other organs. So it's unfortunate medications were just shuffled around, but the problem, the disease process persisted. And now you have a situation with advanced kidney disease. What do we do today as our initial evaluation?
We start with doing some labs and tests for evaluation, and also the nutritional part is very important because the patient is still consuming the regular diet. I forgot to mention that the patient have symptoms of bloating and indigestion. Yes. So
that could be just a GI problem, a microbiome problem, dysbiosis. So that could be a problem that could be contributing to elevated blood pressure. Yeah, and so we'll address that. For the sake of the audience, if you have a loved one or yourself, you may have something like high blood pressure or whatever. Don't just let your doctors just adjust medications. Look at various other things, hydration. Ask about your electrolytes, micronutrients, magnesium. Ask about gut health, those types of things. These things are important in trying to get total body health, and these things oftentimes need to be addressed. When you look at something that seems to be as simple as hypertension, 1 or 2 meds, get the blood pressure in control, and you're good, not necessarily. Because the underlying problem is not being addressed. So I look forward to seeing how he turns around, and we'll keep posted. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.